In London, you can get a coronavirus test in a drive-through. The UK has tested over 7,000 people so far. They've got less than 20 cases confirmed. In South Korea, yesterday alone, they tested 12,000 people for coronavirus. In the United States, we have apparently tested a few hundred people total. Why is that? I mean, I understand the test is under development and there were some problems with it and it's getting fixed, but I mean, the UK and South Korea are very good friends of ours. Can't we just use their tests? They apparently have thousands ready to go. I mean, that's one of my admittedly ignorant questions about how the United States handles this. But boy, do I have many more. Joining us now is Donald McNeil. He's a science and health reporter at the New York Times. Mr. McNeil has covered AIDS and Ebola and SARS and swine flu and bird flu, and now this coronavirus crisis as well. Mr. McNeil, thank you very much for being here tonight. I appreciate it.
Thank you.
First of all, let me ask you a terminology question. I'm still calling it coronavirus, and that's the way most people are still talking about it. The official name is COVID-19. Do you think it matters in terms of how we talk about it?
No. You know, it's politically incorrect but to call it China coronavirus, but Alexei Azar keeps doing that. But it is the coronavirus that came from China. The only reason you might not want to say the coronavirus is because there are 6 other coronaviruses we know about.
Including MERS and SARS?
Including SARS and MERS, and 4 coronaviruses that produce the common cold, and you've had them, and I've had them, and everybody we know has had them at one time or another. They produce 25% of the common colds in this country.
But this is a novel iteration of the coronavirus.
This is the 7th.
Let me ask you about SARS and MERS. I addressed that briefly a little bit in the introductory remarks because the White House Chief of Staff Mick Mulvaney today at a political event talked about SARS and MERS and said those were much worse. Those had kill rates of 10% or 30% in terms of the number of people who got infected and then what proportion of those people died, basically implying to his audience that if you weren't afraid of SARS or MERS, you definitely shouldn't be afraid about this. This one only appears to have a lethality rate of about 2%, therefore it's much less scary. I think his math is backwards in terms of explaining the potential risk and the scope of this epidemic, but I wanted to get your perspective on it.
He's completely right about the lethality rate, and he's completely wrong about the danger. The 1918 flu only killed about 2.5% of the people who got it, but it was so transmissible that it circled the entire world through 1918 and 1919, and a third of the world got it. If a third of the world gets this disease, that's 1 billion people. And so the deaths are going to mount into the millions, many millions.
The transmission rate here in Italy, where they have had one of the worst outbreaks outside of China, local officials said today in the region of Italy that appears to be hardest hit, they think they've got 4% of the local population infected. And what they're observing is a transmission rate on average of 1 infected person infecting 2 other people. Tell us about what that means in sort of epidemiological terms. It's
pretty early to make that guess in Italy's outbreak because it's only been going on for a couple of weeks. But, you know, 4% of the people infected so far doesn't mean anything. This, you know, the 1918 flu was the 1918-1919 flu. It hit hard with a relatively mild wave in the spring. Then it somewhat disappeared in the summer, which is the reason for President Trump saying it's all going to be gone by April. Then it came back in an absolute killer wave in the fall and winter, and that's when most of the people died. And this potentially, although I don't like to predict the future, has a, you know, it looks like something like that.
When you talk about a third of the people on Earth getting it, in 1918, they obviously didn't have jet travel. They didn't have the kinds of global connections that we've got that we're rapidly seeing shut down as we see an economic contraction around this and travel restrictions of all kinds. Is there anything that people that governments or that individuals or that health authorities ought to be rationally pursuing toward the aim of containment, or is that folly?
No, they already pursued it, shutting down air travel. I mean, the fact that we stopped air travel from China and China dove on its own viral grenade and shut down travel within China actually bought the rest of the world quite a bit of time, I think. But we've already run out of that time. Tedros, the head of the World Health Organization, has been saying there's a window of opportunity here. There's a window of opportunity here to do something about it, but that window is closing. All right, that window has not completely closed, but it's closing more and more and more as the virus spreads to new countries.